Hey everyone, my name is Dr. Michael. I'm Dr. Michael's son. I'm a medical doctor, so I work in a hospital. Actually, just started my residency earlier this year, and I'm doing my residency in neurology. And I'm down at UAB Hospital in Birmingham. Okay, so I was asked to kind of walk you guys through what placing a central line was like and kind of my experience with that. And I guess the whole purpose being how to tackle something that you have no idea about, and how to overcome those obstacles. So basically, this procedure is really done for very sick patients who are mostly going to be in the ICU. General medical floor patients don't need this procedure. This is basically an IV. I don't know if you guys have ever seen just a small IV that kind of goes like right in your wrist right there, or on the top or wherever, just wherever you see small veins. This kind of procedure is for people who need very strong medicine that can't go into the peripheral vasculature. Some of those medicines are very caustic to the veins, and it can actually cause a lot of damage to those veins, and you won't actually get the medicine in if you blow those veins out. So basically, that's why you need a central line, because it'll allow for more potent medicines to be given. And usually it's like blood pressure medicine, stuff to make your blood pressure higher or lower, or very strong antibiotics to treat blood infections. So those are the kinds of patients we use them on. They're usually very sick. Now, the first part of any procedure is to go and get what we call consent. Basically, the person saying that they agree to the procedure. You have to tell them the risks and things and the benefits and whatnot. Basically, this is a very low-risk procedure, but you do have to inform the patient that there is a risk of bleeding, that there's a risk of infection, and I really think that's about it. Those are the two things. You have to do a lot of stuff at the beginning too. You have to make sure you check their blood coagulation properties to make sure that their blood's not too thin, and that they can actually they can handle the procedure. Okay, so once you find the patient that you need this in, and that they're a good candidate for the procedure, then you have to go and place it, or you have to go do it. And basically, in residency, it's all about teaching. So it's a lot of people who've never done them before, or have not done very many of them. And I'm one of those people. I've had to place a few, and I've never done them before residency, really. I mean, a couple of times I was involved in them, but being kind of the boss at that point it's crazy, because then you have to just kind of take control of the situation, and you have to act like you know what you're doing, even though you may not. And that's the one thing about going into any new career or a situation where you maybe take up a leadership role. You may not know what you're doing all the time, and it's okay to let people know that, but it's not okay to be extremely anxious and whatnot. You have to be confident, even in your even if you don't know what you're doing. And so that's important, because if you are really anxious and acting all nervous and shaky and stuff, then people are going to be really nervous around you, and they're not going to trust in you, and things just go badly when that happens. But regardless of that, so I'll just give an example of a patient. So this patient needs a central line. One of my supervisors comes and says, "I need you to go place this in this patient over there." And I say, "Yes, sir." And so I go and get all the materials that I need. Especially doing your first few, you may not know what stuff you need, and that's okay, because you need to find out, you need to learn. So go and talk to the nurse. The nurse will tell you, like, well, they usually get this, this, and this. So I go get those things and put them in the room. I talk with the patient, make sure they know what's going on. I get the consent and everything. And then at this point, we're ready to do the procedure. So now we have to make the room sterile. And this is a sterile procedure because we're going into a major vessel that if you introduce bacteria in, you could cause some major problems. So basically, you don't let anybody in the room. You make sure the patient is isolated. No one's going to be touching them. And you're basically the only person that's doing doing the actual procedure. Okay, so I go and get my supervisor. They come in the room with me, and I kind of just let them know, okay, this is how I'm gonna do it. Just let me know if it's wrong. This is an incredibly important part of, I think, learning in general, is that if you're tasked with doing something, or if you're given an assignment or anything, it's to your best benefit to give an attempt to figure it out on your own first. And then if you still can't figure it out, then you go and talk to the teacher or your supervisor or whoever. Because if you're given an assignment and then you try to look at it, you think, oh man, this is too hard, and then you go to your teacher right away and they see that you didn't do anything, they think that you don't care, and that you just want them to walk you through it so that you can get it over with. So always give an effort, like always just try to search something on your own or ask somebody how to do it, and get an idea first before saying that you can't, because truth of the matter is everything's on Google. If you need some assistance, you can find it on Google or YouTube or something. Like you can search on YouTube right now for how to put a central line in, and it'll teach you way better than I could in this video. So that's just something to take with you, and that's something that has helped me a lot in becoming a doctor, is just realizing like not everybody's just going to be able to give me the answers, and sometimes you have to learn how to search for them yourself. In fact, a lot of the time you have to take responsibility for your own education. But anyway, off of that, going back to the procedure. So bring the supervisor in, I tell them, okay, this is what I'm going to do, and then I go and do it, as long as they say it's okay. So basically for this procedure, you first get your ultrasound that can kind of visualize the veins and whatnot. So for putting one up here in the subclavian vein, you want to make sure you get your ultrasound probe over the spot. You find where you want to go, where you think that the vein is, and it's very important to get the vein and not the artery. You find that place and you mark it with some marker or something. Okay, now you cleanse the area with chlorhexidine wipe thing. Basically kills all the bacteria in that area. Next, you're going to get lidocaine, and you're going to numb the area so that the patient can't feel it. Patient may not be unconscious for this procedure, so you have to make sure that they're nice and numbed up in the area that you're going to be poking, or else it'll be very painful for them. Okay, next part is to get your needle, and you also get your probe, your ultrasound probe, and you're basically going to go back to that place where you marked, and then you have your needle as well. You double check, make sure that you're going into the right area, and then you actually go ahead and advance the needle once the skin is numb. The needle goes in, and if you've hit the correct vasculature, in this case the subclavian vein, which is right under here, under your clavicle, if you've hit the right area, you pull your thumb off of the needle, and a slow drip of blood should come out. If the blood is like spraying out like a squirt gun, you've hit an artery, and that's the wrong thing. So that's where you have to pull it out and then like place pressure over it, and that's just not good. So you got to make sure that you hit the right vein to start with. As long as you get the vein, you leave the needle in there, put your thumb over it, and you get this wire. I'm not really sure what it's called, but it's a wire. It's kind of got like it's kind of like a guitar string. And basically you just push the wire into the end of the needle about 30 centimeters. And so basically what's happening is that from the subclavian vein, you're pushing this wire in across, up over into the superior vena cava, down into the heart. It basically goes all the way into the right atria of the heart. And so that's where it will end up, is over here, the end of the wire. Now you pull the needle out, and the next thing we're going to do is take a small scalpel and place and cut just a small cut right where the needle goes in. And the reason for doing that is so that we can place the catheter. So we've cut a small little cut near or like on the wire. Now we get the catheter or a dilator. You place it over the wire, and basically the dilator does what it's called. It dilates the incision spot so that you can actually put the catheter in. So once you've dilated, you pull back out, maintain pressure at this point because there can be a lot of blood coming out. And then that's when you place the central line on the end of the wire, push it all the way in. And after you've dilated, the central line should go right in, and that's the catheter. And so once you've done that, basically you have to make sure that you're in the right area. So you wait for what we call flashback on the catheter itself. You put like a saline. Well, actually, yeah, you put a saline syringe on the end of it. It's really hard to explain it without having one. But basically, pull blood back and then make sure that there's blood able to come back. If the blood can come back, you know you're in the right area. And so you end up pulling blood back and then squirting some saline through just to make sure that everything is open and in the right place. Okay, once you've made sure, so if you have there are different kinds of catheters. It can be like 3 lumen or 2 lumen. And that basically means how many sites that you can infuse medicine. Once you've made sure that all 3 of them are patent or open, then you're good to use that catheter. It's good that central line is good to use. So at this point now, we sew it into place with a couple of stitches, and then you clean up the area because there's going to be blood everywhere, and then you can dress the area with some patches and whatnot so that people don't mess with it and stuff. So the whole process, like if you've never done it before, is really scary because this is someone's life. It's in your hands, and it's a procedure where you're sticking this massive needle in them. And like doing this the first time, I was like horribly sweaty. Like my scrubs were drenched with sweat afterwards because I was really nervous. But you know, in the midst of it, you have to kind of, in a high stress situation, you have to remove yourself from the nerve-wracking parts of it and just realize this is not for my good, this is for the good of this patient. And as long as you can focus on the right things, the nerves shouldn't be so bad. And honestly, being a little bit nervous for anything is okay. Just to think about some of the greatest like sports players, none of them would tell you that they're not nervous in high stress situations where maybe the game is on the line, and the greatest players are still nervous, but they can focus through that nervousness. And that's really what it takes doing these kind of medical procedures. And if you're not nervous doing these kinds of things, then there's something wrong. If you're not nervous in a high stress situation, then you're probably going to mess something up, or you don't care, or something. And so, I don't know, it's just, it's okay to feel a little bit nervous when you're doing something new. And even if you've done it 100 times, you probably still should be a little bit nervous for those things that could happen in the worst situations. So with all that said, learning to do a central line was difficult at first, but actually doing it and getting through it was actually not as hard as I thought at the beginning. So anything new that you're maybe struggling to learn, it's definitely doable if you have enough time and if you have enough gusto to do it. But anyway, so that's how you place the central line. And feel free to ask my mom any questions, and if she'll send them to me and I can answer them. But it's great talking to you guys, and I'll see you later. Bye.